Are veneers the only treatment option we have whenever we do a smile redesign or smile enhancement cases? The answer is no. It varies from case to case according to the needs of the case. That's why we'll go through different cases discussing different treatment options we can offer in each one of them. Let's start with a very simple case. A patient comes to the clinic with a very well-aligned teeth that looks good in shape, and the only thing he needs is whiter teeth. Obviously, the first treatment of choice would be teeth whitening in this case. But after verifying very important points with the patient, number one, the shape that the patient wants to achieve. Number two, the instruction that comes after teeth whitening. Let's start with number one. The teeth whitening technology in the market offers certain degree of whitening, certain limits that they cannot exceed. So if the color or the shade the patient chose is within the limit, we can go ahead and do teeth whitening. Otherwise, we have to go to veneers. The second point, the instructions after the teeth whitening is very important, which are avoiding smoking, tea, coffee, any colorful food or drinks for at least a couple of days after whitening, preferably a week after whitening. Those instructions are very important. If the patient doesn't stick to the instruction, he will not benefit from teeth whitening. So if we have a patient that says, no, I can't adhere to those instructions, we shouldn't be doing teeth whitening for that patient because he will lose the results immediately. So, in a brief, a patient who is willing to adhere to our instruction after teeth whitening and a patient who is asking for a shade that we can achieve through the teeth whitening technology, we go ahead and do teeth whitening. Otherwise, veneers will be the option for those patients who wants shade that's way whiter than what we can offer through teeth whitening, or who is not willing to adhere to the instructions after teeth whitening. Also, if a patient doesn't want to go through teeth whitening every year and he wants to achieve whiter teeth once and for all, veneer will be the option for having whiter teeth. While in other cases, patients will come up to the clinic with well-aligned teeth, but they don't like the shape of their teeth or even the shape and shade of their teeth. In those cases, we have to study the smile really well to be able to decide, do we really need to cover the whole outer surface of the anterior teeth and sometimes even the premolar to give a beautiful smile all over, or we can achieve a very nice results with only some minor touch-ups here and there. If we decided that minor touch-ups are fair enough, we can do them with composite filling or with even small porcelain buildup. And believe me, a good dentist, a good talented dentist would know exactly where to add, where to reshape, and he will be able to achieve beautiful results with minor touch-up in cases where no major changes need to be done. But if we decide that we really need to cover the whole outer surface of the teeth, we will go to something called veneering. Veneering can be done with composite, which is the white filling, or with porcelain. The white fillings are good for veneering, but they're not color stable. So for those patients who smoke a lot or consume lots of tea and coffee, the color is not stable. It will change. And always they will need to come up for refinishing and repolishing the veneers, the composite veneers, to keep them in good shape. While with porcelain veneering, the color is much more stable. The color is really stable. Still, the patient has to come for his 6-month recall to make sure everything is fine and to make sure the gum is doing well, but the color is really stable and more durable. Another case would be a patient coming to the clinic with malaligned teeth, means malpositioned teeth, whether the teeth are on top of each other or having any kind of malalignment. Usually those cases comes with two scenarios. Either a patient comes with malaligned teeth but the shape of the teeth is almost perfect, or the patient comes with malaligned teeth and bad shaped teeth that needs to be altered. The first scenario, where the patient comes with very nice shape of teeth but they are malaligned, Once we finish the alignment, whether with Inman aligner for front teeth or the traditional ortho braces to align front and back teeth, once we're done with the alignment, we don't need to do anything. Maybe teeth whitening or a touch-up of composite filling here and there to perfect the picture. In the other case, we need to align the teeth and to reshape the teeth by composite veneering or porcelain veneering. But why do we have to align the teeth first? Why not to go to veneering from the beginning? That's a very important question. The answer is, by aligning the teeth before doing any treatment, we're saving your teeth structure. Because imagine teeth on top of each other and you want to veneer them. In that case, you have to prep a lot from the tooth structure to be able to find that nice alignment of the teeth and to achieve good results. So, by aligning your teeth before any other treatment, if they are mal-shaped, you are saving tooth structure. And this is something very important.